Very important to be aware of the contents of their medicine cabinets. So speaking of medicine cabinets and contents, it is crucially important for the elderly to secure their medication so children don't ingest them accidentally, or worse than that, their teenage grandchildren will steal their pain meds to get high or sell them on the street to buy something of their choice. So it's important to have a lock and key for class 3 or 1 or D level medications. It's very, very important to do this. So the families have to be educated. Unfortunately, there are many elderly who don't have any family left, or families who are not able to perform this service for one reason or another. This is where we have visitation of social workers. And they don't have to be highly educated with a master's degree, but even a bachelor's degree or even less, someone trained to listen and to talk and to count and to dispense the medications. Even on a weekly basis, they kind of like a checking in and seeing how they're doing. I mean, you can even train the people who do Meal on Wheels to also checking their medications when they come every day for their lunch. So there are many resources we are not using that are already in place that could be, with just a little effort, trained to fulfill this wonderful service of being a guardian angel of the pharmacy of this person.
How about, let's talk about for a couple minutes. Walking when you don't need to walk, walking while you're intoxicated, walking, everybody's very concerned about the elderly driving. In actuality, more elders get run over when with alcohol or drugs in their system than get killed in automobile accidents.
And actually, more elderly are killed in their own home by falling, breaking a hip, getting pneumonia, and dying. So many of these drugs, because of orthostatic hypotension, that is when you get up, your blood descends and you lose consciousness momentarily, there comes the fall, there comes a broken hip, many of them then get pneumonia and die. So they don't even have to leave their home to die from accidental falls or incidents related to the drug overdosing or even regular dosing. Doesn't have to be overdosing. Of course, needless to say, the elderly should never drive, like anyone of any age, if they're intoxicated with any medication. If they're starting a new medication, they should start it, I recommend, on the weekend to see the effect they have before they do anything that would be even cooking, where they could forget and set themselves on fire. That has happened as well, with a nightshirt catching in the flames or whatever the case may be. So it's very important that they feel what the medicine will do to them so they know how to respond to it and react.
This is an uncomfortable question. How well can they be held accountable to the law when they abuse the sale of their drugs?
I think that they should not be held accountable at all. If a grandparent has a teenager who breaks into their medicine cabinet to steal their Percocets, for instance, and sell them, the grandparent is an innocent victim, not a participating party. On that very same subject, we are approaching the idea of we want everyone to enforce the DEA regulations and drug laws when a physician and a pharmacist is not a detective or a policeman. And we cannot place the burden of enforcement, law enforcement, on professionals who are swamped with other paperwork due to the mega medical model and the HIPAA laws, which are thousands and thousands of wasted hours doing paperwork. These people cannot be enlisted to be the enforcers for the drug enforcement, for the DEA or anybody else. We really need to have the ground floor education from the bottom to the top and not from the top down. If you look at the pyramids, they were built from the bottom to the pinnacle, and this is what makes them strong for 6,000 to 7,000 years, not the other way around. So it must be built from the ground floor up, education in the most elementary level, going up to the top. Physicians need to know as well that it's not okay to get rid of a pain in the neck patient because they're coming in every week because they don't get better and they get, more and more pain. I recently myself experienced a knee surgery, and I was given 50 narcotic pills. I didn't take any of them. I took aspirin and used ice. Young people and older people need to be told pain is part of living. It's your body telling you not to move, to let it heal. You're going to have to endure a little bit of discomfort. Give it a week and it will go away. I know mine did. I'm not talking about intractable cancer patients now, of course not. They should have all the medicine they need to keep them comfortable in palliative care.
I have a question. Mark, can you help out, maybe you have it in front of you? We need to we need to hear you, Tim, and make a statement about Worcester, where you're from, and the high stats of the abuse. What is it, death? Is it like, what is it, as a state as a city in the state that has one of the highest problems?
I got it.